So now we're looking at the hood weight with the anterior chest weight. We can see the large roll back here. The hood weight is exerting a pressure that goes superior to inferior, anterior to posterior. This is the fulcrum here. So we're getting a force and a counter force coming down the front. And we can actually see this is a kyphotic S-curve with the hood weight and the anterior chest weight is starting to bring that cervical lordosis back in. So we're looking at a patient here with the DMX, and we start to look at the lateral cervical x-ray. We kind of got a kyphosis up on the top and a lordosis on the bottom. This is with a 5-pound hood weight and an 8-pound anterior chest weight, and we can see how nicely bring that curve back in there. We went from 197% loss of curve to a 5% loss of curve with a 5-pound hood weight and 8-pound anterior chest weight. This really needs to be done for 90 days for proprioceptive neuromuscular education. Patient needs to do this at home. It's best if they do this either walking around or on an air disc or on the vibrating platform. So now we're going to look at how it changes with some of the weight there. We're going to start with a lordotic kyphotic neck. This is a 2-pound head weight and a 3-pound anterior chest weight, and that starts to bring lordosis back pretty well. Then we decided to change it to an 8-pound anterior chest weight, a little bit heavier, and that didn't do anything at all. The body reacted in a negative manner there. So now we changed it to a 5-pound hood weight and an 5-pound anterior chest weight. We can see how this whole neck is collapsing. That's a sign. I just want to come back here. Okay, that's a sign of too much weight as far as the hood weight goes. So then we go back to the 3-pound anterior chest weight, 2-pound head weight, and we're doing fine. We're going to look at one here. We're just going to go with an 8-pound hood weight and a 10-pound anterior chest weight. So lordosis kyphosis. We're going to go with the tube in the lower neck area, and he reacts really nice as far as bringing that cervical lordosis back into position. This one first. So we look at this one, and we're actually seeing this kind of a kyphosis, or lordosis, kyphosis, lordosis. We started with a head weight and an anterior chest weight, 2 pounds, 5 pounds, there was no change. Then we went to 3 pounds and 5 pounds, no change. At least not the reaction that I wanted to see. Now we're actually going with a hood weight and an anterior chest weight. We're starting to see that cervical lordosis come into play here. And then what we find that ended up, we went with a 3-pound hood weight and an 8-pound anterior chest weight. And we did that. It brought that curve back really nice and also decreased the forward head posture. So that's how we figure out what we want to do. You can do this with x-ray, and we can take a look at posture as well. So here we have lordotic kyphotic S-curve, so we want the small tube in the lower neck going with a hood weight, and this is 3-pound hood weight, 8-pound anterior chest weight, and it brought that cervical lordosis and decreased the forward head posture just like we want to see.